Hello, my name is Natira Holmes, and I'm going to be giving a presentation on the effects of cognitive behavioral therapy for veterans with depression. So this is an area of concern because suicide is rising in the veteran population, and the most prevalent mental health disorder is depression. Most people think about PTSD, but depression is actually more prevalent than PTSD. So this is of concern because according to a study by Ashrafion, nearly 65% of veterans who were endorsing suicidal ideation were suffering from depression. This study that was conducted through the Department of Veteran Affairs showed that suicide in 2014 was the 10th leading cause of death in the United States. And of the deaths that were committed by suicide, 18% of them were veterans. And that study also showed that the average amount of veterans who commit suicide each day is about 20. So when compared to civilian adults, veterans are at 21% higher risk of committing suicide. Males have an 18% higher risk compared to civilian males, and females actually have a 2.4 times higher risk than their female counterparts in the civilian sector. So this is of particular concern because the study also showed that there is a rise in suicide in age groups of 18 to 29 years, 50 to 69 years, and 80 years and older. So this is something that we definitely should be concerned about. A study done by Carlin showed, the study actually wanted to see how cognitive behavioral therapy, specifically for depression, would affect the older and the younger veteran population. He wanted to compare the two. So therapists were recruited for this, and they went through rigorous training through the Department of Veteran Affairs or the Veterans Health Administration. And they actually recruited about 864 participants in this study. And overall, the results revealed that cognitive behavioral therapy for depression was effective for both older and younger veterans, equally effective. Then another study by Hopfall was done, and this study was interesting because it was actually done here in Chicago, where I'm located, over at the Rush Hospital. And this program was done online. It was a program called Vets Prevail. So this program was an online intervention that was still cognitive behavioral therapy. This program did not have any therapists involved. There were cognitive behavioral therapy modules for the veterans to complete online, and then they received support from other veterans, their fellow service members. This was actually a good thing because it helped decrease the stigma of going to seek help for mental health, which we know a lot of people don't want to admit that. And it also gave them some encouragement because it was with their fellow veterans, somebody who can relate to them. So overall, there were 209 veterans that were involved in this program. And then there was a control group of 94 participants that didn't do pretty much anything. It was adjustment as usual, which means nothing. So the Vets Prevail program showed symptom reduction and a decline in symptoms of depression. Now, this study only was to evaluate mild to moderate symptoms of depression. The severe depression symptoms were not analyzed for this. When we compare both the studies, because we want to know how is this important and why do we as future advanced practice nurses need to know this? Well, this is important because cognitive behavioral therapy has shown to be very effective in decreasing symptoms and managing depression. My particular interest is in the veteran population, but not just with veterans, but in general it has shown to be effective. What's important here is that for nurse practitioners who don't or who won't be working in the Veterans Health Administration, it's particularly important to establish a rapport with your patients and try to understand where they're coming from, what it means to be a veteran, and what kind of stresses veterans face in comparison to their civilian counterparts. I myself am a veteran, and there's some things that still haunt me day to day that I have to manage on my own. So I think it's really important for nurse practitioners who may be working with veterans in the future to try to understand that. Also, the reason I mention that actually is not just because it sounds good or because it's something that you should do. There's actually statistical data that shows that the majority of the suicides in the veteran population were of veterans who were not seeking care through the Veterans Health Administration. So I believe the study said that of 20 veterans who committed suicide, 6 of them were being seen at the Veterans Health Administration. So that's a large gap. So it's important for advanced practice nurses to keep those kinds of things in mind. So I'm going to wrap it up. I hope that I addressed some things. If not, just when I present this on the discussion post, ask me whatever questions you may have. I just want to mention that the Veterans Crisis Line number is listed on the slides as well. And want you to remember that May is Mental Health Awareness Month. And Memorial Day is coming up. So keep that in mind as well. If most people have barbecues and stuff for Memorial Day, but let's try to keep in mind the veterans that we have lost either through combat or through suicide, which is a rising concern. So thank you for your time, and I look forward to seeing everybody else's presentations, and I look forward to chatting with you online. Thanks.